Emergency care in Europe. What does public health insurance cover? Imagine you're exploring a beautiful European city when suddenly you feel a sharp pain or get into a minor accident. You might wonder, will your health insurance help you in that urgent moment? Knowing what public health insurance covers in Europe can make a big difference in how you handle emergencies abroad. When you have a valid public health insurance card, like the European Health Insurance Card, you can access emergency medical care in most European countries. This card is free and easy to get before you travel or move. It allows you to receive urgent treatment at public hospitals or clinics, just like a local resident. If you are staying temporarily in an EU country, the European Economic Area countries, Switzerland, or the United Kingdom, this card is your ticket to emergency care. Emergency care means treatment that you need immediately because of a sudden illness or injury. For example, if you break a bone, have a heart attack, or suddenly develop severe symptoms, public health insurance will cover the necessary treatment. It does not cover routine visits, checkups, or elective procedures that can be scheduled in advance. In most cases, you will pay the same fees as local residents. These fees are usually small co-payments, which vary by country. For example, in France, emergency visits might cost around 10 to 20 euros, while in Germany, it could be a few euros for certain services. If you need an ambulance, calling the universal emergency number 112 will connect you to ambulance and emergency services. It is important to remember that public health insurance in Europe generally covers only public health care services. Private health care, private hospitals, or private doctors are usually not covered unless you have additional private insurance. Also, costs like transportation back home, rescue services, or repatriation are not included in public coverage. You should consider private insurance for those situations. For Americans planning to live, work, or retire in Europe, understanding this system is key. If you become a legal resident and contribute to the local social security or health insurance system, you will be entitled to public health insurance, including emergency care. Visitors can get the European Health Insurance Card before traveling to ensure they are covered for urgent needs without high costs. A good tip is to always know the local emergency number, which is 112 across most European countries. Also, familiarize yourself with the nearest hospitals or clinics that accept public health insurance. Keep your insurance card and any medical documents handy, especially if you need to claim reimbursements later. Remember, healthcare systems differ from country to country, so check the specific rules where you plan to stay or visit. In short, public health insurance in Europe covers emergency medical care that is unplanned and necessary during your temporary stay or residency. It does not cover planned treatments or private health care. Being prepared with the right coverage and knowing how to access emergency services can help you stay safe and worry-free while enjoying life and culture in Europe.